Welcome to the Roselle Center for Healing webinar lecture educational series. I'm your presenter, Dr. Stephanie Pina, naturopathic physician and licensed acupuncturist, and one of the practitioners at the Roselle Center for Healing. And today's lecture is going to be on fibromyalgia. It is one of the lectures that we get asked to do very often, and people are very interested in getting updated information about how we treat fibromyalgia naturally. And so we'd like to update you with this webinar and move forward from there. I hope you enjoy it. What we'll be covering today and how can we help you? We're going to be reviewing the definition and a list of symptoms and different things associated with the diagnosis of fibromyalgia and discuss how they are a real diagnosis and they're related to each other. The more we can understand how the different parts of fibromyalgia are related, the more we can best come up with a treatment plan to suit an individual patient. We're going to look at the causes and the physiology behind why fibromyalgia has such widespread chronic pain that can migrate and move and come and go as it pleases, but how it also involves the physiological response of different nervous systems and different types of systems that are commonly related with patients who have fibromyalgia. And those symptoms can also change with time as well too. We're going to start to think outside the box for options that include how do we improve current treatments, such as the different medications that are currently being offered, how to improve patient involvement in care and getting them more active involved with working with their physicians, whether they're the holistic physicians or their primary care physicians and rheumatologists, and also how to monitor progress beyond just doing pain management. We're going to present a shift in this mind thinking that basically helps us gain momentum in understanding fibromyalgia and where it might go in the future by looking at not only its past, but different new options as far as treatment management from a holistic perspective. And then we're going to cover much more as well too. Hopefully we'll be able to answer some of the questions that you might have, and if not, feel free to contact myself at the office, and that way we can get your questions answered as well too. So let's continue. Fibromyalgia in itself has greatly spread over the U.S. and worldwide, with between 15 million and 10 million people being diagnosed. And that number is probably even low considering that fibromyalgia diagnosing criteria has changed over time. These numbers are actually older numbers, so there's probably more people diagnosed or in the process of being diagnosed. Unfortunately, because fibromyalgia has a number of different symptoms related to its condition and where it's considered a syndrome instead of an actual disease because there's no known etiological cause, a lot of people get undiagnosed for a long period of time, or they're diagnosed with other types of conditions. But 70 to 90% of the people who have fibromyalgia are women, and it's very interesting to look at the different understandings of why women may be more affected than men. However, men are starting to become more diagnosed with the newest updated 2016 credentialing. And essentially what we see is also that's not always a genetic factor as well too. Although first family generation members, if they have a family member with fibromyalgia, they're 8 times more likely to have it themselves. But only 50% in recent studies was seen to be caused by genetic results, and then 50% epigenetic or environmental. A diagnosis can actually happen throughout an entire lifetime, but typically what will happen is for women, they'll be diagnosed in their middle age from 20 to 50. But then essentially that's can deal with primary fibromyalgia where there is no cause and treatment. This may be able to deal with the different fluctuations in hormones and stress, and essentially men start to be diagnosed a little bit older. However, what we do see is that that's with primary fibromyalgia where there's no particular case or trauma or injury that we know of that creates this chronic pain, fatigue, sleep issues, and digestive issues, and mental emotional strain. However, what we do see is that with secondary fibromyalgia, we know that there's a treatment or a cause that usually created the issue, such as an accident, an injury, or a trauma. And that's where we usually see the incidence of fibromyalgia go up between men and women. According to 1990, that's when the American College of Rheumatology first came up with diagnostic criteria for fibromyalgia, which included widespread pain in 4 quadrants of the body with at least a minimal duration of 3 months. And essentially, this is also where the charts with the trigger points actually came from. So most people are familiar with these trigger points or tender points that are tender to the touch. And in order to be diagnosed with fibromyalgia, you need to have tenderness at least 11 of these 18 trigger points. At that time, this was the primary criteria for diagnosing fibromyalgia. And now with the updated 2016 criteria, it also includes the other symptoms such as chronic fatigue, digestive issues, IBS, and other issues as well too. So let's continue. The next couple of slides are basically some of the history behind the diagnosis and some of the terminology behind fibromyalgia. And this is kind of interesting to look at and read on your own, but essentially what you'll see is over time when people started to think that there was actually an issue going on, they actually started to develop not only criteria for diagnosis, but also it kind of leads us down the pathway of how a treatment might be discovered and utilized. So when we look at the older history all the way back to the 1800s, essentially what we're seeing is that people needed to come up with the terms first for different types of rheumatic conditions that involve musculoskeletal pain, especially that didn't come from an origin from an injury or a trauma that was known. And as more information was learned about how nerves and the nervous system works, they realized the idea that there was types of things called referral pain, where one point might be tender, but the pain actually went somewhere else along the body. It traveled along the nerves. And we see this oftenly used to not only diagnose fibromyalgia, but other types of conditions, as well as used in treatment with, say, acupuncture, dry needling, and even with other musculoskeletal points. So when we started to kind of understand that these points or these tender points or trigger points were available, we started to use them as diagnostic criteria and realized that fibromyalgia had this idea of hyperactive nerve endings were going on. It wasn't until 1880 that basically this widespread pain was also started to be put together with signs of fatigue and physiological disturbances or psychological disturbances. And Dr. Beard was the first one who basically came up with the idea that stress might actually be causing some of these issues. This might have been the first time when they started to realize that multiple things were causing muscles to get tightened and shortened, and that stress and chronic stress might be one of those issues. The term fibrosis was first coined in 1904 by Sir William Gowers, and essentially that started to get the idea that this wasn't a joint pain, it wasn't joint inflammation, but it was inflammation in and around the connective tissue, that this new kind of connective tissue that surrounds joints and muscles and even organ systems may be inflamed in itself and create pain, that there's fiber and nerve endings there. And essentially, 1968 was eventually when some of the first ideas of fibrosis was truly recognized of what we started to think of as fibromyalgia today, that it actually was a continuous and chronic condition. As more history started to continue, Dr. Smith was the first one and also known as the great-grandfather of modern fibromyalgia. And basically he was able to notice that this was a widespread condition, that it wasn't just localized to one particular area, and that he also started to add additional ideas to this idea of myofascial pain syndrome. And this also included the idea that sleep irregularities and the idea that we weren't able to get deeper sleep, phase 3 and 4, which is the restorative phase that helps us actually heal, was partially due to this pain syndrome. Whether the person couldn't sleep throughout the night or they were able not to get to a deeper level of sleep, they weren't able to heal properly. Dr. Eunice was the first one that essentially created and looked at the history behind fibromyalgia and started to realize that other symptoms such as pain, fatigue, and poor sleep were more common than people were thinking of, and that fibromyalgia really needed to be recognized as its own condition. It still was seen as a syndrome and still is now, instead of having a diagnosis as a disease, because it doesn't have one particular treatment or cause. But essentially, he was also the one that noticed that tender points were much greater and in more locations than originally thought. In fact, when you touch a fibromyalgia patient, even though you might use the 18 trigger points as a diagnostic criteria, which is used less and less now, but essentially they could be tender anywhere they get touched on the body as well. This kind of idea led to this idea of central sensitization, which is essentially that the brain is so sensitized to the parts of the body that it actually creates a hyper sensitivity response, that the brain and the spinal cord can actually have an effect on the rest of the body and the way we interpret pain. In 1990, as I mentioned, the American College of Rheumatology was the first one to put together an official diagnostic on widespread pain and tenderness and included these 18 trigger points. They are listed bilateral up the body, and you can see a small picture of them on the right-hand side. But that was used for inclusion criteria for a number of years. And then in 1991, what was interesting is the Fibromyalgia Impact Questionnaire was developed for doctors to use for evaluation. And this was when we was giving to the actual patients so that they could start to give their information on some of the other symptoms that they were experiencing and how different types of treatments was actually helping or hurting their treatments. In 2005, the American Pain Society released the first guidelines on how to treat fibromyalgia pain, including drug therapies. And then in 2010, they released an alternative diagnostic criteria that used the questionnaire alongside the tender points. They revised their questionnaire in 2016 to make it a little bit easier and to allow for the physicians to actually do the diagnosing, and actually took more of the stress and strain off the patient. They limited how much the questionnaire would actually be able to be used, and they started to know that you'd see widespread pain in a number of different regions of the body instead of just these different trigger point signs. The symptoms such as fatigue and sleeping issues, mental emotional issues, brain fog, even digestive health had to be present for at least 3 months still. So this is where the common diagnosis kind of continues. But a diagnosis of fibromyalgia was valid irrespective of other differences. The diagnosis also did not exclude the presence of other clinically important diseases, which is also good because with chronic disease, we see numerous other chronic diseases involved with it. Fibromyalgia has a big characteristic of being commonly seen with chronic fatigue syndrome and other autoimmune diseases like rheumatoid arthritis and lupus, which is also going to be more common in women. But there may also be other issues that have to deal with pain sensitizations and nerve issues such as diabetes and also cardiovascular disease. So inflammation in the body may also heighten the awareness. What we don't see here in this present revision is any kind of understanding of what the actual causes might be that create an issue with fibromyalgia. This is one of the typical surveys that's commonly used to actually measure for patients what their fibromyalgianess, which is an actual word, is. So even though it's not used in the diagnostic criteria, it is a good method for patients who are interested to see if some of their symptoms might be related to fibromyalgia to go through and see if they actually get a score that's high enough to make them considerable for fibromyalgia types of treatment. It could also be something that's used in treatment therapy to actively get a patient involved with their therapy and to help monitor from the physician's standpoint of how one or many different therapies are doing. One of the important things that I think personally with fibromyalgia and the fact that it's considered a syndrome versus a disease, I think it's playing a part into how it's actually treated and why it's misunderstood for most patients. When they come in, they often aren't taken serious that their symptoms are even related to each other. So as we start to go through the following slides and discuss on how that connection might happen, we have to take into consideration how the medical community is seeing fibromyalgia to begin with. So let's just quickly look at this definition between a disease versus a syndrome. A disease in itself has to have an established biological cause behind it. We have to know how to measure it, know that it's actually there, and know when it actually happened. It has to have a defined group of symptoms, and it has to be consistent with changing in anatomy due to the condition. So again, everything that you can see on paper in a laboratory or in some kind of imaging has to be present. A syndrome, on the other hand, which is a Greek word for running together, can be a number of symptoms that are all produced together without an identifiable cause. This may cause suggestion the possibility of an underlying disease or other chances of developing a disease. So what's interesting is fibromyalgia falls under this, just like polycystic ovarian disease or syndrome, and essentially also like metabolic syndrome. So even though they themselves are a list of number of different symptoms, essentially they're actually the precursors for additional other health conditions that are usually chronic in nature. So if we've always called syndromes just this collection of different types of symptoms, does it mean that we can't take it seriously, that we can't treat them where they are because we don't have anything to find that says here's how it changed in the body, here's how it changed on a lab? So this particular quote was interesting. For a reason above, the treatment of a syndrome is mainly symptomatic. In the case of a disease, the underlying cause is treated. If we can't find the cause, it doesn't mean we shouldn't be able to treat it. Essentially, in holistic medicine, we always want to go back to treating the root or the cause, but essentially it doesn't have to be one particular thing. So with fibromyalgia, there's no particular lab test available. There's no particular imaging available. So everything seems normal. There's no joint inflammation or changes. There's no breakdown or tear in the muscles. There's no issues with finding inflammation in the colon or reason why the person's not sleeping, or even different types of hormonal conditions or essentially mood disorders. It's definitely not a psychological disease. So someone who has depression and anxiety is not creating fibromyalgia, even though that chronic pain can create anxiety and depression later on. So essentially what we can do, though, is use markers that we see in other chronic care, chronic conditions, chronic pain conditions, to help monitor to see if there's an underlying disease that's also available, and treat not only symptoms, but try to treat what we might consider the cause of disease, which might not have been treated properly in the first place. And we'll get into the different types of causes of fibromyalgia in just a moment. So a lot of times patients are coming in and they're being told it's all in your head. And I have to say yes and no to this particular issue. It's not in their head as if the symptoms that they're experiencing and feeling aren't real, but essentially we do know that the brain and the biochemistry that happens within the brain can actually create some of the pain issues that we're going to review in just a moment. So a lot of times we end up having discussions with patients about the types of treatments and who they've spoken with before as far as their diagnosis. We have to understand when people come in and they're in chronic pain, not only is that going to affect their pain at a local tender point area or in a local muscle area, but it's going to affect their ability to function, their ability to think properly, their ability to have a normal day. So in that particular case, any of the information they can give us about what makes them worse or better, how they've been managing, how they've done with side effects with different types of medication can essentially give us great ways to treat them. And that's a little bit thinking outside the box as well too, because it's not a matter of just giving another medication, which may just blur the symptom or just treat a symptom. We have to think about how to treat the full body. So when we look at the causes and how we would use different types of holistic therapies to treat the body, we have to essentially think about what's going on with the person. As I always tell my patients, their homework is to basically pay attention to themselves, because they know themselves the best and they'll be able to give me the best understanding of how things are changing within their body. Now, when we talk about it also being in their head, essentially we've seen functional MRI images like you see on the left here. And so what you see on the left picture is a normal brain in a functional MRI unit. So it shows how active the brain actually is. So a patient that has fibromyalgia, you can see that clearly where you see red and yellow, there's more activity going on. There's more firing going on. And this can lead to some of the hypersensitivities that they have, whether light or sound, touch, different types of senses and stimuli start to activate some of their symptoms. We see this basically lighting up different parts of the brain, including the prefrontal cortex as well too, that has to do with how we experience and how we react, our emotional responses. It also is lighting up the part of the brain that has to do with the motor neurons as well too. So how do we feel things and how the muscles respond as well. On the right side of this slide, you see basically some of the other symptoms that are contributing to the suffering experienced by fibromyalgia patients. As more and more people consider that fibromyalgia should be a disease and essentially has to be treated that way, we see that some of these different issues have to be taken into consideration. Not every single fibromyalgia patient is going to experience these symptoms, but essentially if they are, we have to figure out how that might differ from the other person. No fibromyalgia patient, just like any patient, is not going to follow into a perfect category, and nor should their treatment. It has to be a very personalized type of treatment, and it may take time. Most patients that come in have seen multiple people being diagnosed with either primary care or rheumatology, but they may have also gone to a gastroenterologist, an orthopedic surgeon. They may have done sleep studies to see if they needed a CPAP or they have any kind of obstructive disease, or they may have even gone to psychiatrists or psychologists to see if they had mood disorders. But essentially all of these being part of fibromyalgia means you have to individually treat each and every single one of them. And understanding how they might be connected together and treating those connections may be a more of a holistic approach than trying to put multiple medications in and multiple therapies that don't seem to work over time. So let's start thinking about some of the causes and what's going on in the body when fibromyalgia symptoms start starting to happen. A lot of time fibromyalgia, also known as a centralized pain syndrome. So again, multiple things going on, but the centralization part has to do with the central nervous system. So the central nervous system in itself is the brain and spinal cord, versus the peripheral nervous system are the nerves that come off the spinal cord and also go to the organ systems. They go out to the skin to reach into the dermatome regions of the body, and they give information back to the spinal cord and to the nervous system so that it can be processed. And what we see overall is there could be a hypersensitivity in the central nervous system that's creating such type of pain syndromes or fibromyalgia. So two things can actually be going on, and they tend to call this the top down and the bottom up types of syndromes. First of all is that the brain itself, or the body itself, is actually relaying pain signals from the part that might be injured or where we feel pain, say in an arm or a leg, and it goes to the spinal system, the spinal cord, and up to the brain. That's where essentially the brain starts to process this symptom. There it could be heightened, and essentially we feel a heightened sense of pain. But at the same time, what can be happening is that the bottom down area or idea is that the brain and the spinal cord are actually relaying pain symbols to areas of the body that are not injured and are not affected. So we feel pain in different parts of the body when there's not actually any physical trauma or any stimuli actually happening. In some ways, this always reminded me of the way phantom limb syndrome can be when a limb is removed and essentially someone still feels stuff going on. The brain is thinking that there's actually still a limb there, so you feel nerve senses there. So in either way, the brain is actually playing a big part into what we perceived as a pain syndrome, and that heightened pain syndrome can essentially create more chronic pain and also widespread pain. Now, we see this when there's not any type of injury or accident in what they call primary fibromyalgic syndrome, and this might be different from a secondary syndrome where things such as injury, trauma, such as neck, whiplash, also pregnancy, different changes in hormones, menopause, even other conditions that affect the nerves such as diabetes, as mentioned before, may start to get the centralized pain syndrome up and running. So essentially a secondary fibromyalgia symptom may actually have a different type of cause. And when we think of other possible causes that might affect this particular type of pain syndrome or fibromyalgia in general, a lot of the times there's a number of different issues that come up. Possible illness and viral infection has been known. Treatments such as, or infections such as Lyme disease can also be part of it. Epstein-Barr, cytomegaloviruses. So some of these viruses that stick around in the system may be able to kind of, over time, create this pain syndrome as well. Different other types of infections such as bacterial infections, fungus, or mold might be the triggering factor. Trauma in itself, whether that's physical or emotional. They're seeing more increased issues with fibromyalgia in young adults that had trauma and traumatic events, especially from an emotional standpoint, as children. And a lot of people have either identified that there was a trauma in their past life, or also this you've seen an increase with PTSD in the military soldiers as well too. Increased stressors can essentially be a possible cause as well too. It can be biological stress or physical stress that may or may not be related to the ones that we already mentioned, such as illness, infection, and trauma. Genetics can play a part in fibromyalgia as well too, but as I mentioned earlier, only in twin studies, they've noticed that only 50% of twins had fibromyalgia actually passed on because of genes, and the other 50% may have to do with their environmental factors or epigenetics. Different changes in hormones patterns, potentially an increase of estrogen that's not balanced out by progesterone may be one of the issues that end up happening with women that are going through menopause, and why that particular time or during pregnancy they start to have more fibromyalgia symptoms, especially compared to men. But one of the things that they have ruled out is that a psychological condition such as anxiety and depression is not a main cause of fibromyalgia, even though chronic pain syndromes can lead to anxiety and depression, which is very common. So overall, the central nervous system and the way the brain interprets pain can have a big part in how we want to treat a patient, because we have to realize that where their pain is actually coming from may not actually be there. And more research now is being placed into trying to figure out how do we differentiate between a centralized pain syndrome that's coming from the brain and going down, or from the body and going up. There's some other ideas that we can think of that it's not making fibromyalgia just a connective tissue or muscle disorder. Again, thinking outside of the fibrosis or the myofascial kind of pain issues that we see. We've talked about myofascial pain with Dr. Browning in a previous lecture as well too. So if you haven't heard that or need to learn more about myofascial pain and the differences, I highly recommend you either listen to the radio show or look up his lecture as well. But some of the other ideas with fibromyalgia can be that neural inflammation, actually inflammation that's in the brain and has to deal with the different brain chemicals such as serotonin and dopamine, may actually get in the way of how the brain processes pain. It's increasing how we process it and firing it, thinking we have to respond to it. So thus the rest of the body actually has a response to it. It heightens the sensitivity to normal stimuli. So what wouldn't normally bother one person now becomes a major issue. And so the body has to respond to get away from that stimuli, which is a normal response in some ways, but essentially this is taking it over the top. We also have this idea that the brain might actually kind of pause or have a decrease of communication between its normal senses. And sometimes this happens between the pain sensor and where we're actually getting the information, or the sensory motor signals. So the brain kind of gets confused essentially on what's going on in what part of the body. So it starts registering that there may be pain in different parts of the body. An idea of this may be when someone has a heart attack, for example, the pain should be coming from the myocardium of the actual heart, but we feel sensation up and down the jaw, down the arm as well too. So this is a perfect idea of understanding even when the body is working perfectly, we may not get the correct sensor of where pain is actually occurring. Also, some of the reasons that fibromyalgia may be difficult to treat is because there may be a decrease in pain inhibition. So some of the medications that we take may not work perfectly because they may not be controlling the correct way that it functions in the brain. Our ability to cut off pain or to stop or minimize it may not be even working. And that can help and delay healing, but also not allow us to do normal physiological functions throughout the day. Poor sleep patterns, as I mentioned before, where we can't get restorative sleep, can have to have a great deal to deal with not only the fatigue throughout the body, but if the body can't sleep, muscles actually get fatigued, so they get tired as well too. It's going to increase the amount of oxygen, carbon, glucose, and basically energy supplies that the body has to make, not only in the brain, but in the muscle, which is going to lead to even more fatigue. There's an idea also that there's an immune issue going on that creates different types of fibromyalgia conditions and symptoms, and that connects the different types of inflammatory responses that we might see, say, in the digestive tract, in the muscles themselves, in the brain, or even in with things that create brain fog and low energy. And the idea that we have protective proteins or cytokines in the body, such as interleukin-4 and interleukin-10, have actually been measured in fibromyalgia patients. And what's interesting is you would think with an increased pain response, they would have increased immune responses, but actually it's been the opposite. These different types of protective proteins have actually been low, so it might mean that fibromyalgia patients are more sensitive to different immune conditions as well too. It would make sense in this particular case that these protective proteins are also not seen in higher amounts with autoimmune diseases, or they have pro-inflammatory interleukins that increase throughout the body. And finally, as I mentioned here, autoimmune infection and hormonal contributing causes may be part of it as well too, which are difficult to actually diagnose in themselves and or measure. So a number of different issues can be taken into consideration that involves the brain and central nervous system, the muscles themselves and the connective tissue, our sleeping patterns and energy utilization, the immune system, and essentially even our hormonal system. And we're going to get into how the hormones are actually getting controlled by the brain as well too. When we talk about multiple system involvement, basically what's happening is in fibromyalgia patients, they're getting depleted of their energy and they're going through an energy crisis. So the brain's most interior portion, or the midbrain, is essentially part of the idea of how we control our normal daily functions and create energy. The hypothalamus that you see here in blue in the inner part of the brain actually helps control quite a few hormones throughout the body and different parts of circadian cycles, such as sleep, hormone release, our day-wake cycle. And essentially what happens if it can't function and get information from the rest of the body, it kind of works as a circuit. So it actually will stop and slow down everything in order to preserve health and healing. By doing that, we can't make more energy. We can't heal. We can't function properly. So the hypothalamus, pituitary, and adrenal axis that we're going to talk about in just a moment and see has to deal with how the body is actually getting information from the rest of the endocrine glands and essentially processing it. That central nervous system is basically an overload. So if it's an overload of anything that the brain controls, which is essentially the rest of the body, it's going to suffer. We also know that there can be immune dysfunction. So if the body doesn't know how to break down a disease, how to take care of it, it not only leads to toxic waste and buildup, but that disease process, such as a long-term virus like Epstein-Barr, chronic virus, and Lyme, may actually continue to linger in the body, and you have to deal with those particular symptoms related to those infections as well. And essentially, we have maladaptive stress and responses as well. When the body goes into stress and into fight and flight mode, essentially it is getting ready to get up and run away. So it tightens muscles, it raises blood pressure, it increases respiration in order to essentially be the most active. But at what cost? When we're always in fight or flight mode, and we see this affect other types of chronic diseases, and we see this be a chronic issue with even acute diseases, that acute state is supposed to be there for a short period of time. That's when epinephrine and norepinephrine are released. But when the body starts to deal with it over a longer period of time, it starts to release cortisol. And that cortisol response will keep us in that heightened sense of response. The adrenal glands that make cortisol essentially stop making other hormones that are critical for life and survival as well too. So there's a response that needs to happen, and the body doesn't know which one to do it. So it stops other responses and other functions in order to deal with this chronic pain and the fibromyalgia symptoms. So what you're seeing here on the left-hand side is a really simple version of what I just talked about. And in the brain, you have the hypothalamus, and it releases hormones not only to the pituitary gland, but also to the adrenal glands that go down, that are located on top of the kidneys. And those adrenal glands release a number of different hormones, but one of the main ones that we talk a lot about, especially in the stress response, is cortisol. And cortisol can go to the immune system to help boost it when we need to fight off an infection. But if it's always doing that, it actually will burn itself out. So we start to notice more fatigue, and our other cycles and rhythms don't do so well. The adrenal gland is also in charge of producing sex hormones and deal with mineral balance to keep our blood pressure up and our water balance and fluid normal. So if it has to produce cortisol all the time to deal with chronic pain responses or to fight off infections that aren't necessarily there, what ends up happening is it stops producing some of these other hormones. There's a feedback loop that goes back to the hypothalamus. And what's missing in this picture also is the fact that the thyroid plays a major part in this whole production as well too. And it has connections with the hypothalamus and the adrenal glands as well. So that essentially becomes our circuitry and our on-off switch as well. So that's why we see other types of endocrine disorders begin to start to happen, and it affects the digestive tract and how we break down stuff. It may affect weight gain and the inability to lose weight, because even though we eat perfectly and we're exercising, our body has gone into fight and flight mode, so it thinks that we have to put everything to storage. So when a cortisol is released, and what's actually happening is what you're seeing on the right side of this picture. The sympathetic system is that fight-flight mode. It's fight, flight, and freeze. So basically, it's going to react. And so what it wants to do is get out of the way and move. So if we're always in that system, what ends up happening is we never have a chance to rest and digest. We can't heal in that system. We're always on the go. So anytime we want to look at decreasing the sympathetic system, we have to think of different ways to improve the parasympathetic system, that rest, digest system, but then we also have to think about how to just make the body relax. And it's easier said than done when someone says just don't stress out or do stress management, because not everybody responds the same way. But the reason why they make it such an important thing as far as controlling your stress is because we know that stress and being in that sympathetic mode creates a lot of chronic long-time conditions, including possibly increasing fibromyalgia symptoms. One of the things we do with this, and one of the ways we try to correct not only the hypothalamus and the pituitary, is essentially making sure that sleep is an issue. So here's a great graphic on some of the best ways we use to restore sleep. And a lot of times we end up sitting down with patients and going over some of the most basic sleep hygiene protocols, like not having lights in the room, making sure that you're getting 8 hours of sleep, even if you feel like you can function over 5 or 6. In the long time, that ends up affecting not only your overall health, but it can actually affect others if you're not able to drive properly, work machinery properly, and even be cognitive what you're doing at work. So restorative sleep has become much more of an issue lately as far as chronic conditions, but especially with fibromyalgia. If pain is keeping you awake because you can't sleep, you have to be able to work on sleep, but also work on the symptoms of pain as well too. So the best thing is to really ask or tell practitioners when you're talking with them about your fibromyalgia symptoms is, can you sleep throughout the night, and is it restorative sleep? Do you feel comfortable in the morning? Do you feel like you need to be able to get more sleep? Other times, what also becomes interesting in sleep is the fact that not everybody has a normal sleep cycle. So they may wake up during the night, and there may be other causes that create that 3 a.m. wake up call or the need to run to the bathroom. So we need to examine to see what is the body telling us the reason why we can't have proper sleep. And then that's part of also treating fibromyalgia symptoms that are involved with sleep issues. So now that we've started to discuss some of the causes of what fibromyalgia syndrome may be coming from and different ways to kind of look at it from a holistic standpoint, what we want to take into consideration is when we're actually working with people with it, their information and feedback is highly regarded. And they may not have been able to give that information to anyone before. So we have to take it very seriously when they do tell us that what has worked for them, what hasn't, what questions do they have, in order to modify a very personalized treatment plan for them. And as I mentioned, this might take time because fibromyalgia symptoms probably didn't determine and be discovered over time. They may have had other diagnoses also that have to be worked on that are key important parts of keeping their overall health. So when you look at it, you have to look at it as a team approach. So this might include the diagnostic team that was the rheumatologist, the primary care. It may involve pain management practitioners who are dealing with some of the common pain management medications such as opioids and different type of NSAIDs and anti-inflammatories or antidepressants. There may be neurologists involved. There may also be counselors involved as well too. So we have to take into consideration and use the best advantage of the information that they've already gathered. You also have your support team, which hopefully is the people that are around you, not only that are counseling you, but those people that you reach out to when times are not good. Like it says here, you're not in this alone. So those might be friends and family. It may be a support group or a Facebook group. It may be even just getting support from getting more literature, sometimes through social media, finding out that the symptoms that you're going through and the different types of treatment you're going through are working for others, or that they've had similar symptoms to you. So your support team involves your diagnostic and your complementary team, but it also can be the people that you rely on a daily basis as well, the people that bring you to your appointments. So it's good when they know exactly what's going on too. And finally, also your complementary team, which in some cases we end up being the diagnostic team or giving back information to your primary care doctors. And essentially this might be anyone between a chiropractor, a naturopath, an acupuncturist, a massage therapist. It might be a physical therapist or a personal trainer. It may be another counselor or, like I said, a support team group as well too. The great thing is that some of these people cross over into these different categories. So really you need to create your team so they can work together to best support your physical needs for your fibromyalgia symptoms. So when we're looking at managing fibromyalgia, we maybe need to think about it from a different approach, and this might be more of a holistic approach in trying to not only just identify what creates this and what's going on, but how do we optimize health and healing? So commonly, and most people, when I talk to my patients, I always ask them, what things have you done in the past? So that way I can learn from them. And a lot of the times they're the ones that will fill me in on different types of side effects from different medications, how often they actually go in to get treated or they're checked up on, what kind of lab tests they're running as well too. So that way I can get a better understanding of what's going on with the other practitioners, since the communication between different practitioners may be difficult. So when you look at fibromyalgia in general, the common things that they treat are going to be the widespread and local pain, which can be some of the symptoms, the associated conditions with it, such as poor sleep, fatigue, digestive issues, which can be either diarrhea, constipation, gas, bloating, or even just a feeling of fullness, emotional issues and mental emotional issues such as fibro fog or brain fog, the inability to concentrate or pick up things or feel like they're stumbling around a lot, irritability and mood swings. Some of the things that are related to certain times and conditions in there are like increased cramping and PMS issues. So those different conditions that particular person might have as well too, there may be another set of medications that are used to address these as well. And sometimes when we're doing that, we see that the adjustments of medications for symptom relief happens over and over again. So they may add in or add a new type of medication in order to just clearly treat some of the symptoms and not think about some of the other ideas that are going on. So this is where discussions between patients and physicians are good, because giving that feedback back not only helps the doctor kind of realize what the patient's actually going through, but what you're experiencing is difficult to measure in this case. There is no lab test, there is no imaging, remember. And then they might continue to do diagnostic measures as well too, to see how your pain tolerance is, how if it's increased or if there's new areas. Some of the diagnostic criteria that we talked about before, or they may end up referring to other people, such as the people that we talked about on your complementary team, or for psychological treatments if they think that needs to help. So if we think about how to address this in a different way, we can think about all the causes, but we want to try to see, in thinking back, how is the body able to heal? What does it need in order to heal first? And obviously looking at sleep, past infections or illnesses, traumas in the past, whether they be a car accident or a fall, these type of small illnesses and even bad posture can be related to how the body is actually doing at that particular moment. You also have to come up with a treatment plan that relates to the acute situation, so where we are today and also where we are in the future. We have to think about, are we giving the body the normal demands it needs for healing? Are we giving it sleep, as I mentioned before, but does it have the nutrients that it needs to heal? Does it have hydration? Does it have everything that it needs in order to move forward? Are you giving yourself that time to heal, or are you under a stressful situation? A lot of times we end up having to address chronic sensitivities and different types of inflammation. So this might be underlying food allergies. This might be sensitivities that create digestive issues or respiratory issues. Sometimes chronic skin issues can also show that there's a sensitivity going on. We have to be able to improve your overall energy. By doing that, you're not only going to have energy to feed the brain so it can function, but also the muscles to help with different types of energy and activity. But that also means we have to understand that as you're healing, you can't go out and run the marathon either. You might have a really great day, but you have to be able to conserve your energy as well too. So a lot of times we're counseling patients on what we think might be best at that moment, maybe not overdoing it too much because they feel great. We have to look at other obstacles that we see in chronic illness, like chronic stress, like the increased incidence of depression, anxiety, and mood disorders. Just because you're dealing with something for a long period of time, and often patients haven't gotten the answers they want, they haven't been taken serious, or they haven't even gotten their questions out. So a lot of times you're dealing with these issues that they've had for a while, that you can't just roll under the table as well too. So making sure that you're giving as much education to patients and that you're able to have a normal conversation with them. Dealing with chronic stress responses and find the best way to help them actually reduce their stress in the long haul will be a great way. And also being able to make changes and adapt to different situations. If someone's traveling, they may not be able to eat the best food. If they're having to take care of others, they may have chronic stressors from being a long-time caregiver. If they're not mobile and functioning, it's going to be difficult for someone to do a lot of exercises. So we have to adapt that situation to their particular needs. And finally, we have to be able to give support and monitoring, and our monitoring may be very differently. It may be that patient just giving us back information and checking in with them every now and then, or it may be looking at other types of blood work to look for information or underlying causes that haven't been treated properly or are still available. So monitoring to see, are we going in the right direction? Does the patient feel something different? How are you feeling as you come in? Is there anything new or different for that particular day? So we know that's ever changing, and with chronic diseases, we expect that as well too. We have to think about treating fibromyalgia patients and the people who are suffering from the symptoms related to this syndrome very differently. And they've actually started to do studies to see how many people are actually going out and looking for alternative or complementary medicine types of therapies in order to essentially add into what they're doing. And what they've seen is 66 to 99% of patients, and I believe it's 1 out of 6 patients has used acupuncture within the last 6 years of their diagnosis. But they've used acupuncture and massage because pharmacological therapies have proved insufficient for relieving symptoms and are not curative. What's interesting in this particular statement is the idea is, are we curing fibromyalgia or are we working with the management of it? And I would say it's more the management of it. But essentially what you're seeing are people asking questions about what other things can help us. So physicians like myself and the others at the Roselle Center for Healing are educated and have information about some of these therapies that you may see and have heard of, and also different things that might be available that need trained supervision, or knowing when things such as dietary or supplements might be the best thing. Because not every supplement is going to be great for every single person, even though there might be great rare reviews for it. So the list you see on the side are just some of the things, again, that we have to take into consideration in order to really, truly treat fibromyalgia. And we need to come up with short-term uses, long-term uses, as well as what combines best together. It may be on the same day or it may be on different days as well, too. For example, using cold laser along with acupuncture or chiropractic care, using lymphatic massage along with doing some minor exercises and keeping someone walking. So overall, we need to still come up with a best plan for them. Which came first? Is it the chicken or the egg? Well, this is the big issue with fibromyalgia. Do you treat a cause first or do you treat where they are? You have to really treat first, so you'll never really know the answer until you start getting the work done. So now we're going to get into some of the individual things that we do at the Roselle Center for Healing, but different concepts as well too that most people may not have had a chance to incorporate into their fibromyalgia types of treatment plans. And the first one we're going to briefly address is chiropractic care. So there's been a number of studies that show that chiropractic care has been able to help fibromyalgia patients. And essentially, if you think about the fact that we're talking about pain that's located in joints and in connective tissue, also they're on the limbs and affect the central nervous system, it makes sense that being able to do modifications and rebalance the nervous system and the rest of the body should be able to help. Different types of chiropractic procedures, adjustments, and manipulations may be what's needed depending on the severity of pain and how the patient presents. So a good chiropractor will know exactly what type of procedure will be best for that particular patient. But essentially, they're able to address the underlying central nervous system and that centralized pain syndrome, address any structural injuries or injuries that may have been in charge of causing some of these fibromyalgia symptoms to begin, and also help return the range of motion. So as someone does become more able and can actually have an increased ability to do things, they're not losing their range of motion and with tight muscles, frozen shoulder, for example, they're able to get things moving again. So it's helping not only with the treatment of it, but also to help prevent other issues that may be coming because of the long-term issues related to fibromyalgia. It can help also in identifying some of the traumas, because usually with chiropractic care, you're asking more questions about small traumas and injuries, such as how does someone sit at their desk work? How does someone, if they've ever been involved with a car accident? So it may look at things completely different, and also if there's any of those requirements that are needed for healing that haven't been addressed. Even nutritional health, sometimes chiropractors can adjust that. We do at the office as well too. And they can also look to see if the body's holding any mental, emotional stressors, but not only looking at how those trigger points are affecting the body, but if there are underlying causes and signs that are creating structural issues. Chiropractic care works well with other adjunct issues such as acupuncture, nutritional counseling, massage therapy, exercise, different types of stress reduction, massage and lymphatic drainage, and also different types of procedures like ultrasound and cold laser can be utilized and has been shown to be effective in treating fibromyalgia patients. So each individual patient has to be assessed and basically seen if chiropractic care is best for them. So some of the studies here have shown that there's actually been great results with using chiropractic care with fibromyalgia patients. In fact, related to essentially some of the other standard of cares they've gotten as far as antidepressant medication, and also how chiropractors have been able to help fibromyalgia and chronic fatigue syndrome. So overall, what we want to do is make sure that the body can actually function best properly, first from the structural standpoint, but also from a biological standpoint, and then also help in its recovery of different things that we might not be working as functioning as well as it was before. The way that it kind of does that is by this idea of the brain-body diagram, which some of you might have seen before. As the brain enters the spinal cord, essentially each one of those spinal cervical nerves basically can go out to not only make the muscles move and also to create senses, but it also goes to the organ systems as well too. So this is how we can explain how an adjustment, say at the lower thoracic or lumbar area, can have an effect on the digestive tract. So by adjusting that oversensitive nervous system and central nervous system for pain response, we may actually also be able to help out with digestive issues, with sleep patterns, even the heart, and adjusting things like doing vagal nerve manipulations can essentially help out with heart rates and palpitations as well too. So we're working on organ systems and also the way we address pain. Also, we can address the dermatomes that are related to the different nerve and cervical areas as well too. So you see dermatomes here that kind of cover the body. So as we adjust certain issues, we can see if there's pain related into those different parts. So for example, the cervical vertebrae at the top cover everything from the base of the neck down through the top of the shoulder and the back. So a number of these fibromyalgia trigger points are related in that C5, C6, and C7 area. So they may need to be adjusted more frequently so they're not firing or misfiring often. So there's a lot of information that we can get from different types of chiropractic care treatments, not only from a diagnostic standpoint, but also help moderating pain and that central nervous system connection with the rest of the body. When we talk about pain as well, what's interesting is this particular lecture was given by an advocate for Arthritis Ireland, where she was talking about her type of pain. And what's interesting is having to address the psychological emotions and also the physical ones. That because there's increased pain perception, we don't know if we can do things. We start questioning ourselves, which leads to anxiety, fear, distress, different types of emotional issues, sometimes depression and poor sleep, which is all feeding into the cycle of some of the physiological symptoms. So would not, as the fibromyalgia starts to continue, we start to notice that we can't do as much anymore. Patients can't exercise the way that they want. So there's actually increased pain with decreased activity, and it further decreased activity because now we don't want to do anything. There's deconditioning of the body, and so overall we just start to avoid different types of activity. So we see patients come in quite frequently with this, and we have to not only treat both that psychological side and the physiological side, but also know that the two of them are playing in together. So a lot of times chiropractic and acupuncture can help to kind of treat both of these at the same time. Acupuncture has also been a very useful tool for fibromyalgia patients. And when I've worked with patients with acupuncture, I've had to modify some of the situations where we're using needles, whether it's the needle stimulation that I'm using or just making them feel comfortable, or working on one area at a time. So there's a lot of different techniques and ways to do acupuncture with fibromyalgia patients, just like it would be if it was a regular chronic care patient or a chronic pain patient, or if it was someone who had other metabolic issues as well too. What you're seeing here are some studies that they've actually done using acupuncture and on what they call sham acupuncture or fake acupuncture points that aren't supposed to do anything. And they noticed that there has been an increase in being able to help out with different types of especially pain-related issues. The treatment groups were able to experience, the ones that got needle did fine. There was very limited negative side effects. And what they were also able to measure is that there was changes in their anxiety, fatigue, and depression. It was better after a 10-week mark. And typically in these studies, the needles are retained for anywhere between 20 to 30 minutes. They may be coming in for treatments once or twice a week. And they may be doing multiple rounds of that with rest periods in between, and then using things such as the symptom survey to help monitor to see how patients are feeling, as well as using different types of pain scales. So there's a lot of information that goes back and forth between patients and their acupuncturists at the same time. So I always encourage my patients to give me feedback on, especially if they're feeling things in a different spot, because we know that with fibromyalgia pain, it can linger, it can move to new spots. So we want to make sure that we're doing the right treatment and we can adjust it depending on where they are for that day and also the long-term goal. So patients that were able to use acupuncture were also able to see that antidepressants usage was also able to be decreased as well too. So their overall effect on their body made changes in some of their medications. This is another study too that actually was an overall review on how different types of acupuncture worked long-term over fibromyalgia patients, and where they actually reviewed 9 different studies over a period of time. And the review was kind of interesting because it showed mixed results, which I always tell my patients we have to treat everyone where they are and know that there might be better techniques that work better than not. So acupuncture was shown to be better than non-acupuncture techniques in reducing pain and stiffness, but it improved overall well-being and fatigue. It was shown for using electrical stim, which is a different type of technique where electricity is actually added to the acupuncture needle to improve overall health, well-being, sleep, and fatigue. And the reason that may happen is because not only are you affecting acupuncture's ability to release endorphins, or the body's feel-good hormone, but it also affects the pain mechanism. So the person was able to actually relax more and get themselves into a more relaxed state, which may also help out with digestion and sleep and some of these other issues. Acupuncture without electric stim was seen to not in these studies to reduce as much pain as much as it was with stimulation. So again, different types of techniques and therapies have to be adjusted for the different types of people that are coming in. And it probably enhanced the effects of drugs and exercise on pain as well too, showing that acupuncture could be used alongside with the conventional therapies that you've been using, or any exercise or physical therapy that's been added in as well. What's seen here is actually the 12 different acupuncture meridians, and what I wanted to show with this is kind of showing you where these acupuncture points may go, how they cover a number of different areas of the body, and essentially it's stretching over the whole body, both the front and the back and the sides. So some of the acupuncture points that you see here that will be along these lines and treats the muscles in the skeleton. About 70% of acupuncture points line up with trigger points or fibromyalgia points. So essentially you can treat localized points, but also further on down, if one area is too sensitive, you have a lot of different options to use. So a trained acupuncturist is going to know when to use localized points and when to use something along these lines that can also have an effect. And this other study was interesting, and it leads into how we also treat here at the Roselle Center for Healing, is that fibromyalgia patients basically did a 12-week study of acupuncture with what they're calling concurrent counseling. And if you look further down, counseling is actually looking at nutrition and how their energy sources are being utilized, how their sleep is, and how they're managing stress and pain. So it didn't have to do with psychological counseling, but basically lifestyle issues, which is a part of acupuncture as an overall Chinese medicine type of theory. And so these were 30-minute sections that acupuncture was done and performed in 2 different sections. They came in twice a week, and they used moxa, which is another common acupuncture theory, which is adding heat to help stimulate energy and to stimulate overall blood flow to a localized area, to a muscle, to help it to relax as well too. And what they noticed is that they saw better results when they were able to do the acupuncture plus this counseling, and also with breathing and relaxation exercises. So essentially they're trying to calm the nervous system down, treat pain and management, and also some of these other things like digestion and sleep, and through nutrition, and get people outside and walking and start to be more active and basically get back to their normal life. So it's kind of interesting to see that it's not just one therapy that actually got all these results that were positive. They had to actually put everything together. So it makes a perfect idea of really to get the body function in multiple ways. So just as we look how each patient has to be treated individually, so doesn't their dietary considerations. So the best way we started that is with a good diet diary to see what someone's eating on a normal basis throughout a week. And really when we look at this, we want to use stuff like an anti-inflammatory, low sugar, maybe higher protein type of diet, perhaps a keto diet or a metagenic diet, and remove the things that shouldn't really be in the diet to begin with that's creating more inflammation. Now, even though fibromyalgia is not based off of inflammation, it doesn't mean the body is not having an inflammatory or hypersensitivity response because inflammation is happening in the digestive tract. We do know that there's a direct connection between the brain and the digestive tract. So we know that what happens there is what we eat is what we are, and vice versa. So one of the main things is we basically have to take sugar out of the body, making sure that's allowing the good bacteria to stay in there, but we're not getting these up and down stimulation grooves. By helping take sugar out of the body, we're actually balancing blood glucose as well too. So often if we can't get good sleep at night, it may be because we're having hypoglycemic attacks during the nighttime and our cortisol levels increase and make us wake up. So basically we feel like we have to feed ourselves. We have to go hunt for food. So what we want to do is make sure that we come up with a great overall dietary plan that involves good food in, bad food out, taking sugars out to decrease inflammation and balancing blood sugars out, removing any kind of allergies or sensitivities, and making sure the food that is going in is healthy, clean food that comes from natural sources. If we can cook it or it's local, that's even better, instead of stuff that has preservatives and stuff that we don't know what's going into it. And then we also want to make sure that the microbiome of the digestive tract, the good bacteria, are able to thrive. So this particular study that they published in Psychology Today was actually looking at women who had fibromyalgia versus those who didn't have actually a lot more not so great bacteria in their digestive tract. So that's going to create issues from a digestive issue as well too. So be able to help get rid of those bad bacteria and to create a better balance is going to be key to their treatment. And also making sure hydration is in place, and that may including electrolytes, like even just something like sea salt, to make sure that the body has the nutrients, but also the fluids to be able to move, function, and it's got all the proper things it needs in order to heal. So dietary components are always going to be part of any type of treatment, whether you just have chiropractic care or medications. When we get to the supplements, some of those supplements that we put in are basically helping out with some of the side effects that might be from medications that are changing our dietary needs as well too. Exercise and movement is really important, so we have to meet the patients where they are. If you're not able to move because of pain, we have to be able to modify it and eventually work towards that goal. We want to go from 0 to active, disabled to functioning, because we realize that some patients can't do much. We have to slowly increase that and kind of understand where are they feeling things. So different types of forms of exercises have been beneficial for fibromyalgia patients, everything from stretching and yoga, especially yin yoga, and that requires more light and gentle movements that can be done, say, seated in a chair if it has to be. Also to using things that are helping with deep breathing exercises, such as meditation as well too. Massage may be able to be used to kind of help work into some of those systems, as well as to promote relaxation. There's been studies that have actually shown that the New England Journal of Medicine did, which is listed below, where Tai Chi and Qigong were actually used to help with fibromyalgia patients as well too in the short term. So those are types of exercises that can be actually done on its own or in a group therapy as well too. So there's different ways to modify it depending on the person's activity needs at the moment. And lymphatic drainage is very interesting too, because it's a light, soft, gentle touch versus even a heavier massage type of pressure. And as you see here, lymph flows throughout the body and basically goes towards the heart. So the red spots that you see here are active lymph spots that are kind of where lymph nodes are that drain the rest of the body. Some of these are very much in the area that you see fibromyalgia trigger points. So you can use the lymphatic flow and movement to kind of help clear the area out and detoxify the area while someone's doing other types of treatments. And this can actually be taught to patients, and they can do it at home by doing things like bouncing on a rebounder or dry brushing, or to the point where they come in and essentially also get lymphatic therapies or use acupuncture to stimulate lymphatic spots as well. Supplements are also there to be supportive, and sometimes we're using those to replace what might be taking out of the body because of the medications, but also we want to basically grab the right kind of supplements for what's going on with that patient. So when we think about boosting energy, acetyl L-carnitine has been one of the ones. D-ribulose has been used. CoQ10 is used because it's often used with heart health, but essentially it's because the heart is so active and it's essentially a muscle. So we need to help support our ability to make different types of energy in the different muscles and utilize it properly. Vitamin C can also help with energy because it helps support not only the immune system, but also helps to support the adrenals and basically kind of help to make sure we can regulate our own cortisol so we're not always running away from the tiger and in that fight-flight response. We can use different types of herbs like boswellia and turmeric and curcumin, B vitamins as well, magnesium and calcium together can also be used to help out with pain modulation effects and to help out with muscle relaxation while the body is being treated. We can use essential fatty acids like different types of omega-3s for inflammation, or using omega acids that are higher in DHA, which has an affinity for brain health. Same thing as B12 also has a form that's essentially better for modulating pain responses related to the neurological system than just energy support. We can use digestive aids such as whole food fiber that helps clear out not only toxins, but helps out with promoting digestive health and good bowel movements. Things that are kind of calming and help support the digestive tract, such as aloe, mint, and ginger. Someone might be better with something that's cooling, like a mint. Someone might be better with something that's like ginger that can also help with nausea and also help support the digestive tract as well too. There's a lot of acupuncture points that help support digestive movement that can be used a long time with some of these supplements as well. And also with sleep, trying to get the body to relax during the night so it can get its best optimal sleep. So L-theanine that's found in green tea, using essential lavender that's on a little bit on the pillow or in an infuser, not taken internally. Melatonin, which B6 helps to enhance, can be taken in certain situations, but there's a certain way to take melatonin in order to optimize it. So even something like a chamomile tea or a sleepy tea can kind of help. And the same thing with magnesium too, which is a natural muscle relaxant as well too, that helps people put into a better mood so they can sleep. And there's other types of therapies that I would say fall into this category, such as homeopathics, specialty diets and exercise and counseling that really need to be personalized for the support. So it's not a one-size-fits-all type of treatment, especially with the supplements, but any of the therapies we discussed here as well too. So that's why working with someone who actually works with fibromyalgia patients and kind of has a chance to work with them on a continuous basis and make the changes that needs to be changed is actually the most beneficial. Another herbal therapy that's been talked about more recently because of its availability is the use of CBD and CBD oil or products with fibromyalgia patients. It's very interesting because you can find different types of products now, like topical, internal, or even in food sources. And the idea that there's more education now that CBD is different than, say, a medical marijuana source. It doesn't have the hallucinogenic factors, but it definitely works on pain modulation on the central nervous system and locally. But then it also has an effect to create calm and relaxation. So which one comes first? It's the chicken or the egg scenario. If you're more relaxed, you feel pain, and vice versa. But CBD is able to affect a number of different receptors in the body, so it can do a number of different things. Most of the research that's been done has been on the full spectrum benefits, so this is the one that has the whole plant involved, which we see in herbal medicine usually gives us the greatest effect versus a true isolate, which has taken out the THC factor. This amount of THC is still not the same as medical marijuana, so it doesn't show you the hallucinogenic factors. But because there's not great regulation of CBD, there's a lot of different forms and sources and companies that are out there. So you really want to talk with a practitioner that can find the best source for you, the best way to dose it, to monitor it. It's a gradual increase, and you kind of find it towards your tolerance. And some patients do get more fatigued with it, so sometimes it can be better when dosed, say, at nighttime during the day. But I know that we personally look for something that's organic based, that essentially is easy to take. And then also we have to think about if it has any interactions with some of the other medications or even herbs, as it does cut through the same pathway through the liver. So it's kind of similar to where you have the warnings on some of your medications. I call it the grapefruit warning, when you're not supposed to drink grapefruit juice or have grapefruit in and around the time that you take medications. You almost want to think the same thing about CBD oil as well too. So that's all things that can be reviewed based off the different types of medications that you have. And there's of course different strains that work in different well. There are different benefits that help, say, for particularly with fibromyalgia patients, such as a mild anti-inflammatory effect but better relaxation effect. It can decrease adrenal cortisol response from chronic stress over time, which helps to decrease that fight, flight, and freeze reaction. So there's less muscle tension, less pull and strain on the muscles, the joints, and the connective tissue. It also allows for more parasympathetic reaction to happen, so the rest, digest, and procreate function becomes more forward. So that's essentially what we're trying to do, is get ourselves into that parasympathetic mode. It can help promote a deeper, more restorative sleep, so that helps out with the fatigue and also allows us to heal more during at night. And then during the central nervous system, it's been shown to help out decrease neuroinflammation. It can be a neuroprotectant as well, by almost being like serving like an antioxidant. And finally, probably the biggest thing that people think of is it helps to treat anxiety, depression, fear, and sometimes some of the brain fog. While there currently at this point hasn't been any direct CBD studies with fibromyalgia patients, there has been a number of other different types of chronic diseases, chronic pain issues. And so we're taking some of that information to know and learn how CBD is actually works directly into the body and using it to help fibromyalgia patients. Speaking of medications, we have to always make sure that we're aware of where you are with your medications and that no changes have been made in recent times with different types of treatments. So we want to make sure that we know what type of medications you're on so that there's no issues with the lifestyle recommendations or the herbs or supplements or even the treatments that we're doing. Common types of medications that we see over and over again, such as Lyrica, is really an anti-seizure medication that's being used for pain. It's one of those ones that are being used more and more now that you have issues with different types of opioids and narcotics that were probably prescribed more frequently. Some patients will actually talk to us about how they have more difficulty getting a hold of their pain medications because pain management practitioners are basically afraid to prescribe opioids with the opioid epidemic, or they're also not monitoring them to make sure that they're still within their tolerance level instead of it being a true addiction issue. And if there are issues with addiction, sometimes it's difficult to get treatment and even the stigmatism of bringing that forward. So things such as making sure that some of the medications aren't depleting things as B vitamins, magnesium, and calcium. Acupuncture can be used as an adjunct therapy to different types of addiction treatments as well, and works with chronic and acute pain. So you may be able to avoid the medications to begin with, but making sure we're addressing basically the medications that a person is on is really important. And all holistic practitioners should at least know how their patients are doing on their medications, if there's been an increase or a decrease or a switch. Because often you'll see that happen with different types of long-term conditions. And also being able to answer any questions or concerns about any drug, herb, or supplement interactions, even that their practitioners have. We've given out information on Chinese herbs that is not as familiar to different types of patients, to give to everyone from cardiologists to rheumatologists. And we're always happy to answer any questions that we might have on that, since some of the information may be harder for them to get a hold of, or they may not be aware of it. We have to treat that patient where they are at that moment, which means a lot of times they're on medications. So we simply can't just take them off a medication. So that's going to require both short and long-term goals. But essentially that the point that says you are here is we have to treat you where you are on day one, with the overall goal of potentially going back to that pain management doctor and asking, is this medication still necessary, or can we make any changes? So we have to be aware of what's going on with other practitioners' treatments as well. So when we put everything together, it's interesting to see how fibromyalgia, involves the nervous system, and we have to be able to calm it down and the effects that it might have on the rest of the body. So they might involve using chiropractic and acupuncture, nutrition and exercise, detoxification and massage. But essentially, we have to find the right thing for every single person. And so as we cross through different systems, like I just mentioned, there's crossover effects that we can use to really optimize these treatments. And the more information and discussion we have with patients, the better it is to truly treat fibromyalgia symptoms, even though we may or may not ever find a true cause. We might want to have to look at, were there infections that may not have been treated properly earlier? Is there trauma that needs to be addressed, both physiological and psychological? And essentially come up with the best treatment plan that also works for the patient that's in front of us as well now too. And hopefully they'll have a support team that is helping them along their way as well. If not, we have to become that part of their support systems too. I put a list here of different resources that I found from different types of other practitioners have also used this as well. But it essentially kind of gives you more information if you needed to dive a little deeper or start to find things that you can use on your own. There's a Facebook page called the Fibro Fridge, which is actually has a lot of dietary support, different recipes. It's based on food support for patients with fibromyalgia. The Insight Timer app is a meditation app that's free, and you can set how much time you want to actually do different types of meditation, whether it's a deep breathing exercise or guided imagery to kind of help relax the mind, to help with sleep, to help with stress during the day. So it's an app that you can actually get on your phone or on your computer. Another practitioner uses this quite frequently, so I thought that was interesting to include. Evidence-based acupuncture website actually has other information on different types of pain management. If you're looking for more information on acupuncture in itself, this is all based off of scientific researches and studies. So it has less of the Chinese medicine-based information that most acupuncturists would know, and really goes after what's been studied over the last 10 to 20 years. I highly recommend, if you haven't listened to the Dr. Tom Roselle live radio show, the podcast, or listen to any of the shows on the YouTube channel, a lot of the things and symptoms within fibromyalgia and even fibromyalgia itself has been addressed on the radio show. So if you go to the YouTube channel, you can actually see about 6 or 7 years, or listen to about 6 or 7 years worth of radio shows where Dr. Roselle has addressed different things that we do, what you've tried and applied, and are looking for holistic or other sources of means to help out with your healthcare conditions, whether it's fibromyalgia or any other condition. Also on the Roselle Care website, rosellecare.com, you have previous recorded webinars, and a number of the webinars that we've done this particular year, which are free to access, they're probably anywhere between 45 minutes to an hour and a half long, are addressing some of the issues that we're talking about, sleep, digestion, myofascial health, chronic pain, that are presented by a number of the lecturers and practitioners that you see in the office. And there's also some previous recorded ones where you see our in-house lectures, which we hope to get back to soon. And of course, because we weren't able to do this in-house, I did leave this, my email address, which is a HIPAA secure, safe email, and happy to answer any questions that you might have, or even do a free 15-minute consultation phone call. You can call the office and say that you need to set up a phone call with me, and we'll find a time to sit down and answer some of these questions if you have any questions before you'd like to come in, or you want to speak to me personally. Happy to answer some of those questions first, and we'll get to the consultation and evaluation offer in just a second. But essentially, we know that this is also done better live, so I know listening to some of these webinars can be long and tedious, but essentially we hope that you're getting some information about how we treat at the Roselle Center for Healing and how that might benefit you or your loved ones. So feel free to share this information with any of them, or have them contact us as well too. And finally, I want to thank you for listening to this lecture. I hope you got some kind of information on looking at fibromyalgia from a different perspective, the different causes and how the body actually creates inflammatory states, but also hypersensitivity states that create very real, very feelable and measurable types of situations that have been overlooked for a long period of time. Unfortunately, where fibromyalgia was just based off of whether or not you had trigger points or you fit criteria, not everybody fit into that criteria, so they didn't get a chance to get treated for a long period of time. So by looking at things from an overall perspective of how your health might be related to your fibromyalgia symptoms, hopefully this will at least give you a little bit of insight on how we look at things. If you're interested too, I would love to give this gift to you. And like I mentioned before, feel free to email me any questions even before you use this. We can set up a quick phone call to go over anything as well too. But at the end of all the lectures that we do, we want to give back to the people who actually have been listening with us, who have been with us for a while, by giving you this Caring for Others. Basically, it's a donation gift to come into the office and for us to sit down and really go over what your healthcare goals and needs might be. It's about a 90-minute appointment, and we go over everything from top to bottom, inside out, and try to come up with a plan that works just for you. Now, the great thing is that this particular offer, which is usually $225 to come into the office, is actually a $99 offer. And essentially what that's covering is for us to go over different things to measure your zinc and pH, your accugraph, which is how strong or weak your acupuncture meridians are, for us to talk as well too, and like I said, start coming up with that plan that works best for you. That $99 actually goes to Caring for Others, which is a 501c3 nonprofit. And it helps us to actually educate the public on natural solutions with common and chronic conditions. It helps pay for care for about 10 patients a year that come into the Roselle Center for Healing who desperately need it for different healthcare conditions, and also provides scholarships for those who are looking for careers in chiropractic, acupuncture, and nutrition. Also during the Christmas season, it helps to basically go towards doing Christmas parties and giving back to a couple of the local charities in our neighborhood as well too. So I'm sure you'll hear about this offer more than once, but essentially, but feel free to take advantage of this. This is really a great offer to kind of come in and really for us to work one-on-one with you if you're serious about making changes, whether it's going into the new year or it's felt like you haven't been listened to before. So if you need to talk with me first on this, feel free to, like I said, give the office a call and we can set something up. Otherwise, you can give the office a call. They'll take your information, and this donation is tax deductible, so they will give you a write-off as well too. And hopefully you enjoyed this lecture and look forward to many more. And hopefully also they'll be in office and you'll be able to see where we work and where we're able to help others heal and come up with better solutions and basically help strive to make everything a little bit better and less challenging for those who are looking for holistic health and care. Let's look forward to seeing you hopefully in the office or on the radio show for the next time we're on. Thank you again for participating in this webinar.